I started Optimal Wellness MD in 2009, basically because I was looking for a practice that offered what we offer here today, a practice focused on prevention of chronic disease, of helping people in my age range, say 30 to 70, optimize their health and age in a healthy way. We focus on preventing disease and managing chronic disease using the techniques of functional medicine. Functional medicine is a fairly new specialty which involves looking for the root causes of diseases and then trying to address those causes rather than just treating symptoms with medication. While I am a traditionally trained physician and I'm board certified in internal medicine and in emergency medicine, I'm also trained in integrative and holistic medicine and functional medicine. So some of the techniques we might use would be some sophisticated laboratory testing to identify the causes of illness, looking for toxins, looking for subtle infections, looking for hormonal imbalances or deficiencies, looking for nutritional deficiencies, and then we put together programs to address those problems. I have treated over 15,000 patients in my career, both as a traditional internal medicine specialist and an emergency medicine specialist, and then continuing on into this practice over the past 10 years. Currently, we treat about 600 active patients with a variety of conditions. We are considered experts in several areas. One is the safe and scientific use of bioidentical hormones for men and for women. In women, we would be dealing with perimenopause and menopausal states. In men, we would be dealing with andropause, or the decline in testosterone. I'm also very experienced in treating hypothyroidism, and we can use bioidentical products or compounded thyroid medications to help patients with hypothyroidism get their thyroid hormones in perfect balance, as opposed to just using some of the more common medications. One of the things we are known for is the use of bioidentical hormone pellet therapy, where we'll use very tiny rice grain-sized pellets of either testosterone or estrogen or other hormones and actually implant them under the skin, allowing patients to have effective hormone replacement that lasts 4, 5, even 6 months at a time. Very few practices are skilled in doing this and monitoring the blood levels required to do it, but we have treated hundreds, if not thousands, of similar patients. Weight loss and diet advice is a prominent feature of this practice. For weight loss, we've been using a ketogenic diet program for the past 10 years that's worked very well for us. It's called Ideal Protein. I have a wonderful nutritionist and weight loss coach, Phyllis, who's worked with hundreds of my patients. I have been an amateur athlete most of my life and actually started CrossFit at the age of 49. So I know firsthand how it is to exercise as a middle-aged person, the aches and pains that can come along with working out hard. And I can advise my patients on nutrition and supplementation to make that easier. I can also give advice on different types of exercise. Maybe not everybody needs to do a high-intensity program like CrossFit. Maybe walking, maybe Zumba, maybe a lower impact aerobic type exercise would be better suited. But I'm very comfortable talking about fitness and exercise to my patients and what diet and supplementation might work for them. A very exciting and new part of our practice is a focus on sexual wellness. And in particular, we are using PRP, or platelet-rich plasma, to do several techniques which can greatly enhance both men and women's sexual function. On my website, you can learn more about the P shot, which is used to treat men with erectile dysfunction, the O shot, which is for women and is essentially vaginal rejuvenation. We are treating folks with hair loss with PRP injections into the scalp. And we are also certified providers of the Gainswave sound wave therapy for men with erectile dysfunction. And you can learn more about this on our website.